This recording is going to cover the female reproductive system. The ovaries are the paired female gonads. They resemble unshelled almonds in both size and shape. They are located in the upper pelvic cavity and one on each side of the uterus. They are held in position by a series of ligaments. The ovarian follicle. These are little sacs or cavities that contain a developing oocyte. They are contained within the ovary, and a single follicle matures every 28 days through the reproductive years of women. The function of ovaries is to 1. Oogenesis, which is the formation and development of the ovum, also known as the ova or egg, and it also functions to produce hormones, and the hormones are estrogen and progesterone. The uterine tube, also known as the fallopian tube, and the oviducts. These are two tubes about 4 inches long that extend laterally from the uterus. They are not attached to the ovaries. The uterine tubes are the ducts that transport the ova from the ovary to the uterus. It is the normal site of fertilization. The structure of the uterine tubes. It would be helpful if you print the diagram so you can follow along and see where the various structures are. The infundibulum. This is the funnel-shaped open distal end that lies close to the ovary. It will end in a fringe of finger-like projections known as the fimbriae. The ampulla. This is the widest and the longest portion, and it makes up the lateral 2/3 of its length. The isthmus is the more medial, short, narrow, thick portion that's going to join the uterus. The uterus, or the womb, is a hollow, thick-walled, highly muscular organ that is situated between the urinary bladder and the rectum. It is the size and shape of an inverted pear, and before the first pregnancy, it measures 3 inches long, 2 inches wide, and 1 inch thick. The anatomical subdivisions of the uterus. The fundus, this is the dome-shaped portion superior to the uterine tube. The body is the major central tapering portion, and the cervix is the narrow inferior portion that opens into the vagina. Normally, the body of the uterus projects anteriorly and superiorly over the urinary bladder. The histological structure. The uterus consists of 3 layers. Keep in mind that the word metron or metrium means uterus, and if you remember your prefixes, you won't have any difficulty with the layers. So let's take a look at them. The perimetrium is the outer layer. It's serosa, and it's part of the visceral peritoneum. The myometrium is the middle muscular layer that is composed of smooth muscle. It forms the bulk of the uterine wall. This layer is important during the delivery to move the child out of the uterus. The endometrium is the inner layer that's composed of simple columnar epithelial tissue and mucosa. It is also highly vascular, meaning rich in blood. This is the layer where the fertilized egg burrows into the uterus in a process called implantation. In non-pregnant female, this is the layer that sloughs or sheds off during menstruation. So what is the function of the uterus? It serves as part of the pathway for the sperm to reach the uterine tube. It's the site of menstruation. It's the site of the implantation of the fertilized ovum, and it's the site of fetal development during pregnancy. Menstruation is also known as the menstrual cycle. It is the cyclical shedding of the lining of the uterus in response to changes in the hormonal levels. It's the periodic discharge of blood, tissue fluid, mucus, and epithelial cells from the endometrium. Although there is often considerable variation in the length of phases of the menstrual cycle from woman to woman, a typical cycle is based on a 28-day time frame. Therefore, the usual frequency of the release of the ovum from the ovary is every 28 days. This process is called ovulation and occurs 2 weeks before the menstrual period begins. The vagina. This is a short canal that extends from the uterus to the vulva, which is the external genitalia. It's considered the terminal portion of the birth canal. It's composed of smooth muscle with a mucous membrane lining. This type of muscle allows the vaginal canal to accommodate the penis during sexual intercourse. It permits the fetus to pass through the vaginal canal during birth. It serves as the passageway for the menstrual flow also. serves as the passageway for childbirth, and it receives the penis during sexual intercourse. The external genitalia, or vulva. It refers to the external genitalia of the female. They are the reproductive structures that are located external to the vagina. The external genitalia will include the mons pubis, which is a pad of fatty or adipose tissue that lies over the pubis bone. The labia majora are two longitudinal folds of skin that extend downward from the mons pubis and are covered by pubic hairs. These contain an abundance of adipose tissue and sweat glands. Labia minora are two small folds of delicate skin. These lie medial to the labia majora and do not contain hair and have few sweat glands, but they do contain numerous sebaceous glands. The clitoris is a small cylindrical mass of erectile tissue and nerves. It is located at the anterior junction of the labia minora. The clitoris is homologous to the male penis, as it is also capable of enlarging by becoming swollen with blood during sexual stimulation. Unlike the penis, however, it does not have an internal duct. The vestibule is the region between the labia minora. Bartholin's gland. These are two small glands that are located on both sides of the vaginal orifice, which secrete mucus, which lubricates the distal end of the vagina during sexual intercourse. The breasts, or mammary glands. These are present in both male and female, however, normally function in the female. They are modified sweat glands and lie anteriorly on the pectoralis major muscle and are attached by a layer of dense, irregular connective tissue. Estrogen causes the mammary glands to increase in size during puberty. Breasts are considered to be an accessory organ of reproduction. They are lactogenic, meaning milk-producing in nature, thus providing nourishment for the newborn. Therefore, the breasts function to synthesize, secrete, and eject milk. Each mammary gland consists of 5 to 20 glandular lobes or compartments, arranged in a radial arrangement around the nipple and are covered by adipose tissue. It is the amount of adipose tissue that determines the size and also gives shapes to the breast and its form. Each glandular lobe has a lactiferous duct, which joins other lactiferous ducts that eventually will empty into the lactiferous sinus. The lactiferous sinus continues as a short lactiferous tubule, which opens at the base of the nipple. The anterior surface of each breast contains a circular pigmented area called the areola, which surrounds the nipple. Milk flows in the following manner: from the lactiferous duct to the lactiferous sinus to the lactiferous tubule to the nipple.